Blood pressure. Blood pressure is prevalent. You can find patients with blood pressure everywhere. Dear friends, once again I am back with a new video for you. Today I will discuss the most popular medicine for blood pressure, which is amlodipine. It is known by different names from various renowned companies in the market, such as Healthy Amlo, Amlong, Amlokind, Amloprates, etc. Speaking of its strength, there are three variants available: 2.5 mg, 5 mg, and 10 mg. The innovator company Pfizer was the first to discover this medicine globally under the brand name Norvasc, which includes three variants: Norvasc 2.5 mg, Norvasc 5 mg, and Norvasc 10 mg. Dear friends, if you are unaware of the distinction between an innovator company and a generic company and the difference between their medicines, please let me know so that I can create another video to clarify your doubts regarding this. Nowadays, you can see blood pressure patient in almost every household. What is the reason behind this increase? To understand the cause and how medication works, I request you to watch this video without skipping any part. Moving on to discussing what blood pressure is. In simple terms, it refers to the pressure exerted by the blood on the walls of arteries while circulating from the heart to the entire body. In the image provided, there are three marked points: normal, indicating no pressure on the artery walls; prehypertension, suggesting the blood is ready to create pressure on the artery walls; and lastly, hypertension, where the blood has exerted sufficient pressure on the artery walls. The animation illustrates how blood circulates through the arteries, creating pressure on their walls as the heart pumps. Let's consider a real-life example for better understanding. Imagine three pipes, which varying widths. The widest allows water to pass easily with no pressure. The medium width pipe causes moderate pressure, and the narrowest result in higher pressure. Similarly, when blood circulates through the arteries, it may cause pressure due to the contraction of the artery walls, resulting in blood pressure in our bodies. Another animation demonstrates how blood circulation through arteries creates pressure similar to the pipe example as I earlier discussed. Now let's discuss how blood pressure values are represented. When you visit a doctor or clinic for a blood pressure measurement, they may tell you that your blood pressure is, for example, 120 by 80 or 135 by 90, etc. The upper value 120 represents systolic blood pressure, indicating the pressure exerted by the blood when ejected by the heart during its pumping action. The lower value, that is 80, represents diastolic blood pressure, that indicating the pressure exerted by the blood on the artery walls between the two heartbeats. To illustrate it further, an animation shows how systolic pressures occurs when the heart contracts to pump blood, resulting in higher pressure, while diastolic pressure occurs when the heart relaxes, resulting in lower pressure. Regarding blood pressure range, if a person's blood pressure is below 120 by 80, they are considered healthy or equal to 120/80. If it ranges from 120 to 129 by less than 80, it is considered an elevated condition. If the blood pressure is in the range of 130 to 139 by 80 to 89, it is classified as stage 1 hypertension. And remember, medication would be prescribed in this stage. However, if the blood pressure exceeds 180 by 120, it is hypertensive crisis, which could lead to severe consequences such as heart attack or stroke, even up to death. Dear friends, now let's delve into the possible cause of high blood pressure. The first and foremost cause is genetic predisposition. If there is a family history of high blood pressure, it may persist across generations, making it challenging to prevent. Means it is not in your hand, you can't be avoided. Secondly, smoking. Smoking is the significant contributor. Excessive smoking can elevate your blood pressure. So I request all of you to steer clear of this habit. Thirdly, obesity, characterized by being overweight, can also lead to high blood pressure. Another factor is stress, which has become a prevalent issue in our society. Mental stress can have detrimental effects on health, including hypertension. Excessive alcohol consumption is another unhealthy lifestyle choice linked to high blood pressure. Additionally, a lack of exercise contributes to the risk. So, I advise everyone to incorporate physical activity into their routines for a healthier lifestyle. And aging. Aging also play a role as blood pressure may increase over time due to various age related factors. Furthermore, that already salt intake, it is known to influence blood pressure levels. Therefore, it is essential to limit raw salt intake, which primarily consists of sodium chloride. So far, we have discussed what blood pressure is, how it occurs, its range, and now let's focus on one of the most common medication, amlodipine. Guys, amlodipine works by blocking calcium channel in the muscle, including those in the heart. By doing so, it relaxes the heart muscle and widens the arteries, facilitating easier blood circulation without increasing the pressure. To illustrate, imagine a water pipe as I earlier mentioned. If it is wider, water flow easily without pressure, similar to how amlodipine widens artery. Now let's address the side effect of amlodipine. Firstly, it may cause edema, resulting in swelling in the feet. Secondly, dizziness and severe headaches can occur. And lastly, palpitation, that is characterized by irregular or rising heartbeat, and tachycardia or rapid heartbeat are also potential side effects. Dear guys, our intention in creating this video is to raise awareness about medicine, not to suggest taking medication without consulting your physician. Please refrain from self medication and always prioritize your safety and awareness. Be safe and stay informed. Thank you.